Hey everybody, welcome back. Today we're going to talk about something that most people will deal with at some point in time in their life, unfortunately. And we want to bring some truth to the matter and really help you understand it really well so that you're not one of them. Or unfortunately, if you are one of them, that you have a different outlook on it. Because this topic, the last time we did an episode or a show on this, it was wild. And
Right. It was.
I mean, to be honest, we saw more new patients and we had a busier month on this one topic alone than we had on a multitude of other topics. And this topic is spinal degeneration.
Here's what's interesting. Okay, so can we just say it up front that as you age and as you get older, there's conversations, there are things that people will say that's like, oh, that's just part of aging, or that's just getting older, or whatever it is, it's normal wear and tear on your body. And
happy 40th birthday.
Yes.
You get spinal degeneration.
Yeah. And it's not true. Like, it literally does not have to be true. And so this is really important today as we talk about it, that if you don't buy into the things that just everybody naturally tells you as you age or as you're getting older, or oh, that's normal, oh, your body's going to start doing this, or oh, you're going to start experiencing, whatever X, Y, and Z symptoms. Those things don't have to be you, but also at the same time, I think it's very important to point out that I was in a yoga class one time with one of my girlfriends, and I thought yoga was like just stretching. And in this class, we all thought we were going to die. I mean, it was like, remember
if you show up to a yoga class and they're playing M&M, that's not a normal yoga class.
Like, one of our buddies got up in the middle of it and like walked out and took a break. I was like,
anytime the word power is in front of yoga.
Yeah. And the girl next to me that was sitting there, one of my really good friends, she looked at me and she goes, well, you think the instructor looks like this on accident? Yeah. Because she was a very, very fit woman, one of our good friends, Megan, who was teaching the class. And we all laughed about it. And I was like, oh my gosh, no, of course not. She doesn't look like this on accident. Like, this yoga is the most intense thing ever. Similar thing here. If you look at somebody who, as they're aging and as you're, walking into the next stages of life, right? And these people that are either fit or they don't have those aches and pains, or they're not one of those people that are like, oh, yep, that just happens to you because you're old now. Congratulations, you're part of the club. Like, there's these people that don't have that going on. And so is it an accident? Absolutely not.
Yeah. So funny enough, I thought you were talking about a different yoga instructor. But the funny thing, and this is the truth, and we'll bring this back. I want to talk about yoga again in a minute, but both yoga instructors, the first one, the one that you're talking about, who we know very dearly, she's married to a chiropractor. And then the other yoga instructor which I didn't drop her name and won't, was a patient of mine. And both of them have been under chiropractic care. And so they're doing these things. And then they have people in their class that aren't under chiropractic care. And we'll bring this back to yoga in just a second. But degeneration, we're going to talk about movement. We're going to talk about your spine moving. And we're going to talk about what that means in relationship to generally moving versus the chiropractic issue. And you've heard this word, we use it all the time, subluxation. But I really want to get to the idea that people think that degeneration has happened. Like, I'm getting older, I turn 40, I turn 50. Yeah, I have degeneration. I hear this from 50, 60, 70-year-olds all the time. When I point out spinal degeneration on their x-ray, they're like, well, I'm 55 years old. Isn't that just normal? Isn't it normal with my age? Isn't it normal wear and tear? And yes, it is wear and tear. The part we want to delete and talk about is the idea that it's normal. Spinal degeneration is a common thing, but it's not normal. It's very common, and it can be age-related, but it depends on how long you've had this other condition, this underlying condition that causes the degeneration. I don't want you guys to think that you hit 30 or hit 40 or hit 50 years old, and then just because of age, your spine starts breaking down, although that's how you might feel based on information you've gotten or what your doctors told you when they look at an MRI or something like that. A lot of times people will come to me, they'll show me their x-rays, they'll show me their MRIs, or I'm showing them their x-rays, and I'll show them degeneration. They're like, well, isn't that normal for my age? And I think we exchanged the word common and normal way too much, because a normal vertebra has good edges, nice articular surfaces, fluid in a disc. The disc is like a cushion and it's working well, and all those discs should be the same thickness all the way down your spine, but that's normal. So when we see something different than that, by definition, that's abnormal. So when someone goes, well, isn't that normal for my age? My first inclination is say, like, no, that's 100% not normal. Normal would be they all look the same. Normal would be this vertebra doesn't look way different than the one above or below it. And I'm like, you're 55 years old. Let's just say that this one that looks bad is 55 years old. What age are the rest of them that look good?
Yeah, right.
Or vice versa. Let's just say the rest of them are 55 years old. What age is that one? And the answer is you were created on the same day. All those vertebrae were created on the same day. All the tissue was created on the same day. So they're all the same age. Why is something wearing out before something else?
Right.
And this goes to, it doesn't have to be the spine. It can be one hip or the other hip or a knee or the other knee, or why a right knee and not a left knee? Why a right hip, not a left hip? And I think that starts to answer the question. And so the new question becomes, all right, then what is degeneration?
Yes.
And specifically spinal degeneration. What is it?
Yes. Yeah. And that's a question that I had, right? That I used to have for a very long time before getting married to a chiropractor, right? Is like, what the heck is spinal degeneration? Yeah. And so we're talking about a number of things, right? Disc dehydration is one of them. Disc thinning or dehydration.
And that doesn't simply mean drink more water, although it might mean you need to drink more water.
Sure.
We're talking about hydration to an area.
So arthritic changes in a joint could be another one. Loss of normal spinal curvatures has some of it. Reduced joint motion.
True.
And that's like, I mean, that's one of the, right? Like if you can't.
Yep.
What was it? We had a family member, right, who was like, oh, I can't look up anymore.
Yep.
Right. I mean, that's essentially what we're talking about there. Not just that, more than that, but, and then bone remodeling and spurring.
Yeah. So like really easily, if you think about going to a nursing home, what does everyone look like? And like everyone thinks this. So like right now, do the posture. What does everybody look like in a nursing home? Exactly.
Yeah.
They're like, you just put a walker in front of them. They just kind of fit out over it. Right. And the reality is, yes, that is what aging wants to do to your body. Why? Why is the human condition forward, head forward, curves moving forward, discs breaking down? Why is that a common thing? Everything you do is in front of you. How many things do you do behind you?
Right.
Other than looking in the mirror when you're driving, paying attention to the person you actually should be least worried about. You try to not to hit the people in front of you. Actually, they should be trying. My grandmother.
That's a funny thing, because I usually don't know anything. I usually know all of your funny things, but how many things do you do behind you?
This was Grandma Berlin. This is a true story. Grandma Berlin.
So good.
She's a very short lady.
Yeah.
And I thought it was because she was short, but she would get she had a Grand Prix, Pontiac Grand Prix. And she would get in and she would turn the mirror up all the way. And I'm like, there's no possible way she can see what's in that mirror. And I'm like, why do you turn your mirror up? Because if you're short, you would turn it down.
Yeah.
But she was short. She turned it up. And I go, why do you turn your mirror up like that? And she goes, I don't need to worry about them. They need to worry about me. They're not supposed to hit me. I need to worry about that guy in front of me. And it was such a... And maybe that's part of what got me thinking different. Chiropractors think different. But my grandmother, I was like, that's actually true to some degree. Like, you don't want to get hit from behind. There is an advantage to looking back, but everything we do is in front of us. Right. You eat in front of you. You take notes in front of you. You read in front of you. Your dad's a pastor. If you want to see a good pastor, if he's not under chiropractic care, what does he look like? He's all hunched over because he spent 50 years in his Bible looking down. Right. Look at nail technicians. Look at dentists. Start looking at professions and look at who starts to break down in this way. And you'll start to understand where degeneration comes from. So this idea, here's the other weird one, is people will have pain, and it's very easy as a chiropractor to point to their degeneration. And they'll assume that's why I have pain. Right. But I'm going to be honest with you. I see very degenerative spines in people that don't have pain in those areas.
Yeah.
And then I've had patients who are in a lot of pain who don't have spinal degeneration. So pain and degeneration aren't mutually tied together.
Right, which you would assume that they were, but they're just not.
They can be.
Yeah.
But when you really understand what causes degeneration, you understand why pain can result from it. But what's crazy, and the nervous system part, when we get to this in just a minute, I'm going to bring that back up because that's a very important thing to really understand. So degeneration doesn't equal pain, but pain is a neurological experience. Mm-hmm. If you touch a hot stove, that is a neurological experience. What I mean by that is for you to touch something out here and for your brain to feel it and tell you, whoa, that's hot. That had to transmit from this area to this area and back very quickly. And there's different receptors we have. Some travel faster, some slower. You could put your hand on something and, like the Princess and the Pea. You remember that story?
Oh, yeah.
So something underneath, we used to do this in chiropractic school. We would take a grain of rice. This is a true story. And we would put it under the page. Do you guys remember what a phone book is?
Yes.
We would put it under, like, the pages were about as thin as a Bible, right? And you would put a grain of rice under one page and you'd feel it and go, there it is. And then under 2 pages. And the competition was how many pages could you, somebody would move the grain of rice and you would feel the page. This is how we would do this. And I can't even grab a toast out of a toaster without feeling like less of a man. When I grab the hot toast out, I'm like, my wife just like grabs it out. And she's like, what's wrong with you? But it was training this nervous system. So we would get to the point where you get like 30 pages deep and it was like, it's right there. And then I was like, 40. And then eventually, the last person could still feel it and you went.
Chiropractic school's a good time, by the way.
Yeah, it's a really fun time.
That's a party trick. Yeah, we should be pulling that out at parties. What's happening?
Beer and palpation don't go good together. So when you get to that, what is this? And this is what it goes back to when it comes to neurological. Is that's a neurological experience. Pain, sensation, sensory is a neurological experience. So do people feel pain when they have degeneration? Absolutely, because it's a nervous system thing, and the degeneration will cause the spine to break down. And when the spine breaks down, it can put pressure on nerves. And when it puts pressure on nerves, it interferes with the signaling. And sometimes it interferes in such a way that it's actually obnoxious. And that obnoxious sensory input is creating pain signaling to the brain. But you can have degeneration and no pain. How is that possible? Because 7% of your nervous system's function, less than 10%, 7% of your nervous system's function is transmitting pain signals, and the rest is actually running your body.
I mean, that's wild, because if you had to test me and say how much of your nervous system is pain, I would say 99.9. Yeah. Like, do you know what I'm saying? And it's just not true.
And I actually was talking to a patient about this today, is that the reason a chiropractor always brings things back to neurology is pain is often what brings people in. But pain can be an indication that nervous system is not functioning well. And if that nervous system is not functioning well, you're coming in talking about 7%. And the chiropractor is also concerned about the other 93%.
Yeah.
What is that 93% doing? It's controlling your heartbeat. It's controlling your lungs. It's controlling your healing. It's controlling your life experience. And so when we see degeneration, we see things breaking down, whether you're in pain or not, we know that the more discs degenerate and the more the spine degenerates, the more pressure and stress and dysfunction it creates on the nervous system. And the unfortunate part is you can have a lot of that going on. It can be affecting all these other things. And you might even be on medication for problems that are happening at organs that are due to interference on your nerves that degeneration is creating, but you're not in pain. And that's the wild part. Or you could be in pain and have very little degeneration. So if they're not directly linked, then what is it? What is degeneration? What is happening And what is this thing that people are concerned about? Because whether you have pain or not, and there's degeneration on your spine or in your spine, or any joint for that matter, you should be concerned because it's going to ruin the functionality of that particular area over time. It's not going to move as well. It's not going to be as strong. It's going to break down faster over time. So what is this process of degeneration and how does it really start?
Right. And so I'm guessing that if you were to ask, like if you were going to do like a man on the street interview and just ask people, you know, about spinal degeneration, which sounds like a really fun man on the street interview, by the way. Like what a hot topic. And you said, where does it come from? And even if it just wasn't man on the street, I'm guessing that if you went to somebody who you thought was knowledgeable about spinal degeneration, that, you know, maybe wasn't a chiropractor, that they would say it's just aging. Like you're just old. Yeah. You just got old. There was a comedian, right, who did that whole bit on, he like hurt his ankle and he went to the doctor.
I think that was Louis C.K.
Yeah,
you just have a crappy ankle.
You just got a bad ankle. Like you're just old. Like that's it. That's just the deal. So I feel like that might be the answer that somebody would give if you were asking them, what is the cause of spinal degeneration? Like what is the cause of that degeneration that happens over time? It's just time. It's just aging. It's just you're getting old. Yeah. And that's just really not true.
No,
right?
It's not true. So here's what happens. Typically, degeneration is associated with one of two things. And the first one is a injury at some point. And the funny thing is with injuries is sometimes we know we injured something and sometimes we don't. Or we injured it so long ago that we have forgotten about it. That happens very frequently in practice that I'll ask somebody, have you ever had a neck injury? And they're like, no, never. A car accident? No. Did you play football? No. Nothing? You never injure your neck? No. And then we start taking care of them. They're getting better. And then they come back a week or two later and they're like, oh my gosh, I don't know how I forgot about this, but I was talking to my mom or I was talking to my sister or whatever. And I was telling them, you asked me that question, and they're like, well, don't you remember when you fell off of the trampoline when you were, or like you couldn't move your neck for a week? And they're like, oh, I actually did have an injury.
Or you have the people that are like, oh yeah, I totally forgot I was hang gliding across the rainforest and we like fell. And
true story. Like, we had a patient who got headbutted by a rhinoceros. True story. Hey, your hip is like beyond normal messed up.
Yeah.
And it's like not only out of alignment, it's like really degenerative. Like this has been going on for probably, 15 years. Did you have an injury like roughly 15 years ago based on the evidence? No. You never had a hip injury? No. Did you have like car accident where your foot was on the brake and somebody hit you and it jammed your hip? No, nothing. You've never had a hip injury? No. Weeks later, he invites us to go like visit the rhinos at the zoo, and he's telling me a story about how a rhinoceros like ran at him and headbutted him in the hip and knocked him through the cage to the other side. And I'm like, thought you never had a hip injury. And he looks at me, he's like, oh my God. I'm like, you'd think you'd remember a rhinoceros headbutting you in the hip. And you guys know I love this story because, I love rhinos, but it's just so funny how like that can actually happen. The second thing that can actually happen is that you do something every day, and it's not one big trauma that you forgot about or maybe didn't forget about, a life-altering thing that did damage something, but it could be the day-to-day. This is this week we are taking care of a young kid, and his mom and dad both do nails for a living, and they're talking about their necks, and I'm like, what do you every day? Go back, I started practicing 2006, and 1 out of every 20 necks that I saw on an x-ray was like really bad. When I say really bad, you're supposed to have a curve in your neck. If you've lost all of it, you've lost 100% of the normal curve, that's bad. Mm-hmm. If it's going the wrong way, that's really bad. Mm-hmm. 1 out of maybe 20. Now it's like 3 out of 5. Mm-hmm. Literally 3 out of 5. Why?
Yep.
All day long. Mm-hmm. And the iPhone came out, I think right around then, early 2000s, and we've just watched it. I mean, if you had a bad neck from a phone pre-2000, you were like a businessman on a BlackBerry 24/7.
Yeah.
Like
the BlackBerries had like the full keyboard. I mean, I remember. Yeah, that was like,
looking down
Yep.
But nowadays it's so common that we see 3 out of 5 kids have a really terrible neck. Mm-hmm. So when I talk about terrible, so this is when it comes to degeneration, there's a couple things you have to know. One is in the spine, okay, and this goes for any joint, but in the spine, you have 24 vertebrae. Those vertebrae are supposed to move freely. So each vertebra moves a little different, but basically they go forward and backward, they go side to side tipping, and they rotate side to side. Your lumbar spine moves a little different than your cervical spine or your neck spine, but they all have to move, and each segment has to move independently. Number 2, you have the alignment of the spine has to be straight. And number 3, you have to have 3 curves to your spine. Those curves, think of a bridge with a curve underneath, and the curve underneath a bridge is to give that bridge its structural integrity. And so if the integrity is there, the curves are there, they're strong. If the spine is straight, that's awesome. But the third thing is each segment should be moving individually. And sometimes something cannot be out of alignment, but it can also not be moving. And that, what happens is now you have all the segments above and all the segments below moving really well. And one segment is stuck, and that's the term that we use called subluxation. Something is not moving. So if everything else is moving and something's not moving, there's now a disc above and a disc below. And now the disc above and the disc below are taking on all the movement that the vertebra should be doing. So what happens to those discs is they start to wear and they start to tear and they start to break down, and hydration. And no, when you drink a bottle of water, it doesn't go to the dehydrated disc. That's not how it works. So people are like, oh, you have disc degeneration and they're dehydrated. People think, oh, better hydration. That's not how it works. Yes, you should be hydrated. Do people who are dehydrated, who smoke and do things that dehydrate the body, do they have more disc degeneration on average? Absolutely they do, because total body hydration does play a role. But when you drink water, it doesn't go to the L4 disc, right? So if the segment is not moving, and or even worse, if it's not moving and it's out of alignment, you have this disc in between, and I use the example, and you've heard me say this, it's like a water balloon in between those two vertebrae. And the job is, if I take my hands, if I had a water balloon between them and I push down evenly on it, what happens is that water balloon swells and it expands out, right, and left. And that's what your discs do. When you jump, when you run, that beating down pressure causes that disc to just kind of expand and go out a little bit. It's a cushion. That's all it is. But if that vertebra is out of alignment and it's putting pressure more on one side than the other, what happens to the fluid in that? Mm-hmm. Like take a jelly donut and squish it on one side. What happens to the other side? All the fluid comes out. Yeah. And then that's where you get the bulging, and people go, oh, is that a bulge or is that a herniation? Technically the same thing. Herniation is a medical term for a bulge. And if your doctor's using bulge, technically it's not a medical term. Herniation is a medical term. Now, what really is dangerous is if that disc breaks or rips. That's called a sequestration, and that's where the fluid now leaves the disc, and that's where it usually gets extremely painful. Now, once that disc has pressure on it in a weird way, it'll start to lose fluid over time. It actually draws fluid in, and it pushes fluid out. Every day there's an exchange, and that's part of the healing process. But if the pressure is constant, more fluid's going out than what's coming in, and then that disc begins to break down. And then the disc breaking down, eventually the bones actually start to remodel around that disc. So the bones actually start changing shape. And this is where bone spurs and calcification, all these things come from. Now, the wild part is you can actually go through that whole experience without pain.
It's wild.
That's crazy. Now, most people, if it's an injury, will have pain and then degeneration. But if it happens slowly, like dentists, imagine leaning forward, looking at someone's neck from one side, up and out the whole time, and your neck's in one position. As that spine starts to kind of change and restructure and remodel, or if you're a secretary on a phone, like the old phones, remember the banana thing? You put
yeah, you can do this.
You can do this. Uh-huh. If you're doing that for a long period of time, what do you think your neck would look like? So there's pressure on one side, those discs are being affected, not on the other side. What side do we think we're going to see more remodeling and more degeneration? So the degenerative process is actually innately your body knowing what's happening or the injury that happened, and it's actually trying to lock that area down so it doesn't get worse. It's actually a very intelligent thing, but it's kind of a primitive response in the sense that it doesn't know you have a chiropractor.
Yeah. And maybe you don't. And so thank God it's doing it. But but you should. And so if you do, then yes, then that's the right solution. But it's really funny because in that, it's like just one of the basic principles of life and of your body and of the way that we heal is that your body's always conspiring on your behalf. And so when I say that, I mean, it's such an all-encompassing statement so that like when you say something like, yes, like this is what the body does, this is how it sort of remodels that bone, which is a wild idea that your body is in there just remodeling bones to react to the way that you live your life, whether it's in a really good way or whether, it's more brutal than the average person or as brutal as the average person. The interesting thing here is that like that is a major tenet. That's a basic principle. And of course, when you say that, it's like, yeah, I don't know that the body, I didn't, like that's not something that I knew the body was doing, but of course, it's always acting on our behalf.
And the body will always try to work to protect an area. Like its goal is protection and then adaptation. So if you're in this position all the time, you're going to develop this degeneration on one side. What will eventually happen is you'll develop a curve somewhere else to compensate, and then that area will later on start to break down. But that's not the goal. That like the body's doing this intelligent thing, but it's intelligent given nothing changes.
Right.
Introduce chiropractic care. So in chiropractic care, what do? We take x-rays, we analyze the spine. What is one of the first things we look for? What's the history? What's the story your spine's telling me? Has there been injury? Is there degeneration? Is there something that's decaying? That's a good word. If you don't fully understand degeneration, think of decay. When teeth decay, they break down, they become brittle, right? But when your spine decays, it's almost the opposite. It actually becomes more rigid, more stiff, more hard. It doesn't move as well. You're like, that's me. I'm 45 years old and I'm starting to feel like I'm getting stiffer, I'm getting more rigid. That is a sign that there's probably degenerative changes going on. So what can we do? Well, as a chiropractor, our job is to go, all right, what's happening in the spine? And then secondarily to that is why. And that's the biggest question. Why? What segments, aren't moving? So during an exam, we're actually moving each segment and feeling for, yep, that one's not moving. That one's not moving. And we're taking note of that. And then second to that, we're actually bringing you through range of motion and going, okay, this person can bend their ear to their shoulder 45 degrees over here, but only 30 over here. This is a fun thing to do. Do this for yourself. Get out your camera phone and videotape yourself, bend ear to shoulder, turn your head over each shoulder, go flexion, go extension. And then you can look up normal ranges of motion, but basically at any age, they should look symmetrical. And if one looks asymmetrical, there's degeneration there. There is. Something's stuck, something's not moving, it's starting to break down, not only in its motion, but eventually that tissue starts to respond. So the third part is why? What's the alignment look like? What do the curves look like? So as a chiropractor, if we go back, we reverse engineer it, we want to go, where is the evidence of degeneration? Where is the loss of motion? And where is the abnormal, position of those segments? And then our job is not to go into that area and go, boom, we're going to force this into different function. It's more about working with the body and unlocking that and trying to put in an equal and opposite force to start to change it and encourage it to change. And this is why anything worth doing is worth doing in repetition. If you're trying to get healthy, if you're trying to eat well, one salad doesn't do it.
One workout. Although sometimes when I'm finished with the workout, I think, well, that should have done the trick for the last 10 years or for the next 10 years or whatever it is. Sometimes you feel like you gave it all in one shot, but it just doesn't work like that.
One date night.
Yeah, it doesn't a marriage make.
One Hail Mary prayer.
Yes. Doesn't a relationship with God make. Yes.
So the same thing when it comes to chiropractic, people are like, well, I heard once you go to a chiropractor, you have to keep going. It's like, well, you were in a car accident when you were 19 years old and you're now 49 years old and you have this degeneration in your neck. So we have 30 years, right, of degenerative changes. And did I say 59 or 49? 20 years? Whatever. You have decades of degenerative changes and it's not going to take 3 adjustments. It's going to take, now here's the good news. In my experience as a chiropractor, it takes roughly a month of consistent care, given you start it the right way, for every year the problem's been developing. So if it's a 2-year-old problem, within 2 months, you're probably going to get back to relatively normal function. If it's a 20-year-old problem, crazy thing is it could take 20 months. Now, that doesn't mean you're not experiencing changes and benefits and all these, life-changing things neurologically. But in terms of getting range of motion back and all this. Now, the other thing I have patients, they'll look at an x-ray and say you're 70 years old and there is lots of degeneration. They'll be like, well, you can't fix that, right? And the answer is no, I can't reverse time in 30 or 40 years of degeneration. And so immediately their brain goes to, well, then you can't help me. And that's 100% not true, because there are tons of people that have lots of degeneration that aren't experiencing pain and are relatively healthy. It's all about, is there pressure on the nerves? Is the motion in the segments normal? So I have patients that have come in and their spines are horribly degenerative, and we will adjust them 10, 15, 20 times, and they'll experience all these neurological changes, and they're feeling better, they're sleeping better, they're healing better. Their sinuses aren't bothering them as much. And then we take a new x-ray and it looks barely different. Like barely different. All the degeneration's still there. Things are maybe changing by millimeters and degrees, and they're like, well, that's crazy. I'm feeling so much better. Like that looks like that. And the one thing you can't see on an x-ray is motion. And this is where I think it gets confusing, because going back to yoga.
Yes.
People think motion equals mobility.
Right. Well, and people think like, hey, my spine is designed to move. I'm moving.
Yeah.
I work out every day.
And I move maybe really well.
Yeah, I move really, really well. I work out every day, or I stretch every day, or I go to yoga, or I see a physical therapist, or I mean, whatever it is that you feel like, this counts as my movement. Yep. Like, that's not necessarily what we're talking about.
I'm not talking about the global movement of your entire spine. I'm talking about, is there a segment? And this goes back to that term I use, subluxation. Is there a truly subluxated vertebra? And let's just say it's in your neck, lower neck, C6, which is kind of in the bottom of the neck. It's second to last vertebra in the neck. If C6 isn't moving well, and it's not been moving well for a while, it could have bone spurs, degeneration, disc damage, all this stuff. But C5, 4, and 3, and then C7, T1, and T2 could actually be moving more than what they're designed to. And they could be overcompensating, and that subluxation's still there, and that disc is still getting worse and degenerating. And now you're creating more stress above and below. People, anybody that hears this, and if you've had a surgery, like this happens, patients come in, and they have spinal surgery where they get a fusion. So now that's permanently fused. And what do I always ask them is, what did your surgeon tell you about future in regards to the segments above and below? And every single one of them, bar none, knows the answer. And they say, I'm going to probably need another fusion because those areas now have to work too much. So think of degenerative changes in your spine as your spine actually trying to fuse itself over time because nothing is being addressed. And so your body's just trying to do the best thing. So your spine is its own surgeon. And given enough time, it would actually do surgery. Right. But unfortunately, with that process comes all the warning signs telling you there is a problem, right? And the body's trying to tell you there's a problem. And then chiropractic is the solution to getting that segment moving, getting pressure off the nerve, and trying to get mobility back so that that disc and that tissue doesn't continue to degenerate. I don't think that God created man and then created the chiropractor. I don't think it was like, man's perfect, unperfect world, good luck. Oh, I forgot, you need a chiropractor. I don't think that's how it worked. What I do believe is that chiropractic and the acknowledgement of God's design and looking at the spine and understanding how it was designed, that the science of chiropractic said, we want to get closer and approximate ourselves more to the original design, and that we benefit from this understanding of the body and how amazing it is, and that there are precautionary measures built in if something gets damaged and doesn't get fixed, And then we go, okay, but what if we could fix it? It wasn't intended to be that way. You weren't intended to get in that car accident. You weren't intended to, look down and do nails all day or stare into mouths all day per se. But this is now damaged. So as a chiropractor, we go, okay, what if we could get this back to functioning more normally? And the cool thing is, and that's my favorite thing about chiropractic, is it's an acknowledgement for what normal is and should be and should have been. And we go, can we do anything to get this more normal? And when we do, that's where healing actually happens, because it's not that we turn on the switch of healing.
Right.
It's that the design was to heal. And the subluxation interferes with the design, and the degeneration starts to lock down that segmental motion. And our job as a chiropractor is to start to reintroduce motion to try to revert things back to more normal. And so the new term, once people come into our clinic, initially we bring them through this process that we call initial intensive care. We're trying to stop something. And then we used to call it maintenance care, but now the term after that, like we go through continued corrective care, but the term after is this new term that I love where we call it protective care. And that we're actually trying to protect this thing that God placed in the center of your body, your spinal cord and your spine that protects it. And we're trying to protect the thing that protects your nervous system over time. So when people go, well, I guess if I go to a chiropractor, I have to go forever. It's like, only if you're smart. Right. Only if you're smart. When I started losing weight and I started eating well, I guess now I have to eat well forever. Only if you're smart. And I would add to that value that thing you're doing.
Right.
I mean, I work out. If I'm going to lose 30 pounds, I got to do it by working out. Now I guess I got to work out forever just to keep the weight off. Only if you're smart.
Right.
I can do this with everything. Once I brush my teeth, I have to always brush them. Once I change the oil in my car, I have to always change the oil in my car. And the reality is, you don't have to do the opposite. See how that actually works out.
Right. See how it works out. And, it's interesting because I think that that's a big question, like where the pain is coming from. Can it be reversed? Like how are those all? And those are all nothing that we do in the office and nothing in general isn't ever, whether it's getting back to, ground zero in terms of like the perfect condition of your spine, whether that's achievable or not, like there's nothing that isn't benefited under the care of removing subluxation.
Yeah, that's true.
Nothing. There isn't, there's no situation. There's no condition that you can have in your health. There's no ability like of yours that isn't better if you're under chiropractic care. Yeah,
the other way of saying that, I guess, would be there's no downside to better movement in any segment in your spine. There's no downside to better nerve function.
Yep.
There's no downside to better tissue healing. So I think then the other question becomes, when do I start? Is it ever too late? And I would say degeneration is an active process. Once it starts, it not only wants to get worse, it usually rapidly gets worse the longer it's there. It's kind of like cancer, unfortunately, that like when you have cancer, usually it's more rapid towards the end, right? Degeneration can start off slow, but it typically gets more rapid towards the end. And then, so the question then becomes, well, when do I start? And you start, like, we think everyone should be under chiropractic care. I'm not going to be bashful about that. Why? Because the first traumas frequently start at birth. That was my story. I didn't necessarily have a traumatic birth. According to anybody in the room, my mom, I think, struggled through it a little bit, but I was stuck in the canal. My head was wedged, in the pelvis. And my first traumas occurred, and mine weren't, degenerative problems, but mine were subluxation creating nerve interference. And had that never been corrected, it would be degenerative problems. So the sooner you can get ahead of it, I'm taking care of a kid right now, and he has a very severe scoliosis. And he's 14 years old. He's the age of my oldest son. And his mom and dad looked at the x-ray and they're like, oh my God, like it's pretty wild. And they looked at it and they're like, how did that happen? And I'm like, I don't know. But, let's go back in time. What was his birth like? What was this like? And he was a forceps delivery. Mm-hmm. And I said, how did he sleep when he was young? Oh, it was horrible. Mm. And the mom started going, oh my gosh, like the signs were there, but I didn't know. We would have had him here way sooner because now his spine's looking all crazy. Right. And what will that lead to? And I had to be honest with him and say, if we don't do something to get movement in some of these segments, are we ever going to correct this spine perfectly? Probably not. But can we keep it from degenerating at the rate that it would if we just let it go? And the answer to that is absolutely. Absolutely. We can slow down the process. I don't know if we can 100% stop, but we can, it can be an unbelievably different outcome. Mm-hmm. And the reason they do surgeries in situations like that is because they're trying to align things and they're trying to get them back straighter because they know that compression on the disc and compression on the nerves actually causes organs to fail and shut down all this. But the crazy part is if you take this crooked spine and straighten it out and put rods in and fuse it, now it doesn't move. And what did we tell you? One of the recipes, alignment was one, but what's the other recipe to degeneration? Movement. A lack of movement. And so that's the other concern. And when the mom goes, this probably goes back to his birth. And I said, that's why we believe that everyone should be adjusted regularly from birth. What does regularly look like? It's different for everybody. Mm-hmm. I've been adjusted weekly since I was 8 years old. In our practice, a lot of people choose to come in biweekly or whatever that standard is. But once you get outside of a certain range, it's no longer regular.
Yeah.
You know what I mean?
Yep.
Do you go to the gym? Yeah, regularly. How regular? Once every 6 months. That's not regular. Not regular.
Once a month. I'm there once a month.
How often do you eat healthy? Regularly. I eat healthy once a year. As regular as could be. You know what I mean? That's not.
How often did you go to the bathroom? Regularly? Once a year?
Yeah.
No.
So regular, it has to add up. So, if you've never been checked, if you've never had an x-ray of your spine, if you've been to a chiropractor, they've never talked to you about this is the conversation they should be having with you. If you've been to a chiropractor or a medical doctor and they pointed at degeneration on an x-ray and they said, well, you're 50 years old. Yeah, of course you have degeneration. That's bullcrap because you don't get your 50th birthday, here's your birthday card, and inside's a certificate for cervical degeneration. That's not how it works.
Yeah, it's not how it works. Right.
It's either trauma, lots of it all at once, or a little bit over a long period of time. And sometimes those traumas are so far back and things that you don't even think about or recall that, never got addressed, and your body has adapted and compensated for it. And sometimes to your advantage, you've gotten away with it. But unfortunately, to the demise of that, it's getting worse. And how long do we wait before we actually find out it's getting worse?
Absolutely. And I think that there's six, we kind of jotted down 6 different reasons, in synopsis of what we talked about today, why chiropractic care is so critical, right? And it's just in general, but it also obviously applies to spinal degeneration, right?
Yeah.
Why chiropractic is critical for spinal degeneration, but then also just in general, why is it so critical? And the first thing is that the spine protects the nervous system.
Yeah.
Right.
And that's, first of all, that's the critical foundation. You got to understand that your spine protects your spinal cord. Your spinal cord is literally your lifeline to everything.
Right.
So reason number 1, your spine protects your spinal cord.
Right. And then number 2 is that motion is a requirement for health.
Yep.
Right.
Yep.
That's 101. Right.
Yep. If you just didn't move, you lay on a couch all day or in a bed for a few days, you'd be miserable. Each segment of your spine feels the same way. So it's not just about yoga and moving and stretching. It's about, are those segments all behaving appropriately? You could do yoga and move and stretch, but you might have 1 or 2 subluxations in your spine that aren't moving and they're actively degenerating while you're creating all this other mobility around them. So the only way to know is to get an exam, get some x-rays done, and find out if there is damage there.
And that goes hand in hand with that idea that you were saying that it's not like you get a spinal degeneration card when you turn a certain age. It's not like when you're 40 or you're 50 or you're 60, here's your card, now you have spinal degeneration. That's not the deal. So if that's not true, and the deal is that it's that lack of motion, then that motion is required for health, right? Yep. Number 3 is that degeneration begins silently.
Yeah, in most cases, it's a silent, slow process, the same way a cavity is.
Right.
Don't get me wrong, you can bite if you ever bit down on a kernel of corn and cracked your tooth, chances are you didn't have a perfectly healthy tooth.
Right.
and then bite down on a kernel of corn and then popcorn, and then all of a sudden your tooth cracked. It's like that tooth was the dentist would probably tell you that tooth was probably internally already decaying. Right. If you bent over to pick up a pencil and your back went out, chances are that wasn't an area that was moving well and was not subluxed. So you go in, you get an x-ray, you should expect to see some degenerative changes in that area because that was there. The kernel of popcorn or the pencil you bent over to pick up was like the proverbial straw that broke the camel's back, because degeneration typically is silent because subluxations are silent. We actually call them the silent killer, because you can have a subluxation putting damage on a nerve, shutting a nerve down, and that might be why you lost your appendix or gallbladder. Right. But the back pain doesn't show up for 20 years later. Right.
Absolutely. We also talked about how function matters more than appearance.
Yeah. You can actually have, we said this, you can have a straight spine with 3 healthy curves. It doesn't mean they're all moving well. So x-rays are part of the exam. The other part of the exam is what we call palpatory exam and range of motion. So we actually have you moving your head side to side. We're checking pelvic motion. We're having you go into these different positions with your spine, because we're looking for what's called intersegmental motion. And then we're actually pushing down on each vertebra, right, left, side, and out. And we're actually seeing this one's moving, this one's moving. And then you hit one, you're like, that one's not moving. And so I make a note, that's T12. Let's look at T12 in the x-ray. Well, most of the time we actually see a problem at T12, but sometimes T12 is actually in a healthy position. It's just not moving. And if you've been a chiropractic patient and you've experienced that, where somebody pushes in and they give a little quick force and you feel pop, and all of a sudden you're like, oh my gosh, that's moving different. If I took an x-ray pre and post, it may not look any different, but you're like, that was it. That's because motion is key. That's the first component we want to get back.
Right. And the last two is that one of them is that consistency beats intensity. Right? Yeah. Like just staying consistent.
Yeah. We're not going to like jump off the top ropes onto you, and drop an elbow into that area of your spine. Like that would be detrimental. But what we can do is deliver, frequent, consistent force over a period of time, and your whole spine can start to change, which is amazing.
And then finally, prevention is always easier than correction.
Yeah, and this is why one of the best things you could do is get your kids under chiropractic care before they ever have a problem, because they play sports, they play football, they're going to drive a car. I was talking to a mom today. Their family has had 9 car accidents in 6 months.
Oh my gosh.
I'd hate to have their insurance right now.
Oh my gosh, yeah.
And none of them were their fault.
Oh.
Their daughter was in 2 weeks.
Oh dear.
And so your kids are likely going to go through, hopefully not that, but they're going to experience, you're going to experience things. You're like, one of the worst is just sitting at a desk in front of a computer with your head forward and leaning in that position and not moving for such a long time. So if you want to give your kids the best opportunity to have a healthy adulthood, having them under chiropractic care when they're young can give them an amazing foundation for health later on, because most of the subluxations and most of the degeneration I see in 40, 50, 60-year-olds are things that happen 10, 20, 30 years ago, maybe even longer. And so this is why our family chooses chiropractic first. It's one of several things we do to be healthy, so that we're actually in the healthcare model and spend less time in the sick care model.